Hi, my name is Nittaya Phanuphak. I'm the Executive Director of the Institute of HIV Research and Innovation, or IHRI, based in Bangkok, Thailand. It is my great pleasure to be part of this workshop and to share with you some thoughts about key population-led health services for men who have sex with men and transgender women in Asia, including in Thailand. Very similar to many other countries in the region, the majority of new HIV cases in Thailand are happening among men who have sex with men and transgender women populations. And in 2015, the Key Population-Led Health Services, or KPLHS, was established to demonstrate that HIV and sexual health related services should be designed and co-delivered by key populations themselves to ensure that services are needs-based, demand-driven, and client-centered. These services are also delivered by trained and qualified lay providers who are often members of key populations. And KPLHS aims to fill in service gaps commonly faced by key population clients. And this is to ensure that services are accessible through flexible service hours and location in hotspots. And services are available and tailored according to needs of each key population. And services are acceptable and provided in a non-judgmental environment. And lastly, services are of high quality. And through KPLHS, we have also demonstrated that HIV and sexual health services can be simplified, which is to make steps less complex, and can be differentiated, which is to be able to identify those clients whose service needs to be more intense, and then clients whose service can be made light, and also through demedicalization, which is to task shift fill roles from doctors and nurses to lay providers. The KP-led PrEP program in Thailand is one of a great example to demonstrate how KPLHS can enhance access to PrEP services among MSM and transgender women in Thailand. And within this same day KP-led PrEP program, once a client is coming into a KP-led clinic in the community, the counseling, the blood draw, and HIV testing will be conducted by trained lay provider. And this lay provider will then share the HIV negative test result to a doctor in a remote hospital via an online chat application. And then the doctor will review the test result and then approve the prescription of PrEP so that the lay provider can give out the first bottle of PrEP or the bottles of PrEP refill to the client almost within the same hour of the client coming into our clinic. And during COVID-19, KPLHS has proved its agility in order to try to maintain, to continue the provision of PrEP services through adaptations. And these adaptations included the use of telehealth and the use of express service, where clients only come in for sample collection, and then test results will be shared with them by online applications or SMS or email, as well as the use of STI self-sampling to reduce contact time between the client and the provider within the clinic. And in Vietnam, during COVID-19, Vietnam's KP-led PrEP program has also successfully integrated home lab sample collection and HIV self-testing in order to continue PrEP service during the pandemic. In the Philippines, the KP-led PrEP program has also been hugely simplified in order to move away from being demonstration project into a scale-up project. And up until now, in both Thailand and Vietnam, the KP-led PrEP program has contributed to the largest number of PrEP service uptake in both countries. It is almost 60% in Thailand and 72% in Vietnam. And this large contribution of KP-led PrEP program in the overall PrEP implementation in the country has led to a few doctors in Thailand who helped to start advocating for sustainability of KPLHS through domestic financing. In Vietnam, the social contracting mechanism has also been explored and implemented for KPLHS sustainability. Now let's talk a bit about the Trans Competent Health Service through KPLHS. In Thailand, the Tangerine Clinic was established in 2015 after a national consultation with trans communities around trans health. And there were two main elements coming out from this consultation, which guided the operation of the Tangerine Clinic. The first one is that the clinic needs to integrate gender affirming care and sexual health care together. And the second recommendation is that the clinic should also engage trans social influencer, because we know and we understand that many trans people rely on social influencer when it comes to seeking health information or making decisions to access health services. And at Tangerine Clinic, a comprehensive set of services range from hormone counseling, hormone level monitoring, hormone prescription, to HIV and STI testing and treatment, as well as neovaginal examination. And consultations with a psychiatrist or a surgeon for mental health conditions or for gender affirming surgery are also available by specialists coming from university and private hospitals. Over the past 5 years, Tangerine Clinic has served almost 4,000 transgender clients who are at high risk of having HIV and STIs, as demonstrated by 10% prevalence of HIV, 12% prevalence of syphilis, and 30% prevalence of gonorrhea and chlamydia. Almost 70% of transgender women clients knows about Tangerine Clinic from its Facebook page, and almost 40% of these clients are those who are first-time HIV testers. And Tangerine Clinic has expanded its technical assistance to many other KP-led trans-competent clinics in the country, as well as in a few other neighboring countries. 3 clinics were established in Vietnam, which are Bien Viet, G-Link, and Life. 2 clinics in the Philippines, which are Victory and Lily by Love Yourself. And most recently, 1 clinic, the Mabedar Clinic, was established in Myanmar. So to conclude, in Thailand and a few other countries in our region, KPLHS has demonstrated to ensure client-centered services. And through KPLHS, HIV and sexual health services can be simplified, demedicalized, and differentiated for MSM and transgender women. KPLHS also demonstrated its adaptability, which will allow flexibility of service provision while maintaining fidelity in any other future emerging pandemic. And lastly, we still need to work harder to get evidences for stronger advocacy to get sincere policy commitment for KPLHS scale up and sustainability. Thank you very much.